We cannot perpetuate a system in which, as you saw from McAllen versus El Paso, we spend twice as much in some areas than others and don't seem to get anything in return for it. Addressing that is going to be very difficult. You can't write down a full list of proposals today that will address it in any kind of definitive way. But we conceptually know, based on the work that has been done here at the Institute of Medicine and elsewhere, the types of things that seem the most auspicious. We are trying to do as much of that as possible, and then perhaps just as importantly, put in place a change in the process so that we can keep up over time with an evolving healthcare market. Separate and apart from that, the health reform that will be adopted at some point this year, working with Senator Baucus and others, will be deficit neutral based on CBO scoring of very clear offsets in terms of Medicare and Medicaid savings and additional revenue. We have already put on the table $635 billion in scored savings, scored offsets. The President indicated last week that we will be putting $200 to $300 billion more on the table in the very near future, in terms with specifics behind that. And you can easily do the math to see that you're then quickly getting into the range of the sorts of packages that are under discussion on Capitol Hill. Do not confuse those two things. We need to do both. We need to address the moral imperative of expanding coverage and pay for it, and we also need to make the healthcare system more efficient.